Hello, I'm Barb Winters. Welcome to McLaren Port Huron's Today's Health. Today we're talking with Hematologist and Oncologist Dr. Anup Lal about anemia. Dr. Lal, welcome to Today's Health.
Thanks for having me. Glad to be here.
What is anemia?
So all the cells in our body need oxygen to function, and what gets oxygen to the cells is our red blood cells. And the red blood cells contain hemoglobin that binds the oxygen in the lung and takes the oxygen to the cells. So anemia is basically a condition where you have low red blood cells and thus low hemoglobin. When we quantify anemia, we usually use the hemoglobin just because it's a bit easier to understand, but you can use hemoglobin or red blood cells interchangeably. So essentially, low red blood cells and low hemoglobin, therefore causing decreased oxygen delivery to cells in the body.
So what causes this?
So there's multiple causes of anemia, and when I talk to patients, I like to kind of break it down. All our blood cells are made in the bone marrow, which is present inside the bones. Now, when you have low blood cells, it could be because you're not making enough, or you're losing cells faster than you're making them, or you're destroying cells faster for some reason and therefore reducing their lifespan. So usually in general, loss, meaning blood loss for some reason, is probably the most common cause. And then decreased production in the bone marrow would be, I would say, the second most common. And the third one, which is the blood breaks down for some reason, immune systems attacking your blood cells, or something wrong with the blood cells themselves causing them to break down, those are somewhat rarer.
So tell me a little bit more about blood cells.
So the red blood cells, like I said, are made in the bone marrow. There's two other main types of cells, the white blood cells, which are responsible for immunity and inflammation. And then you have the platelets, which are the smallest cells. These are responsible for helping the blood clot when we cut ourselves. The red blood cells are by far the most numerous, like approximately your normal number of red blood cells is about 4.5 to 5 million in 1 milliliter of blood. And the red blood cells contain the hemoglobin, which is an iron-containing compound that binds oxygen in the lungs and then transports the oxygen to different cells, all the different cells in the body, like we talked about. So, and it's actually the red blood cells which give the blood the red color.
So are they renewing all the time? What's the life of a red blood cell?
So a red blood cell is produced in the bone marrow. It starts off as like an immature cell that goes through certain steps before it becomes a mature red blood cell. So that process of production in the bone marrow takes few days to happen, anywhere from 7 to 14 days. Once a red blood cell comes out into the circulation, into our bloodstream, the normal lifespan is actually about 3 to 4 months.
Wow, so there's a constant process of turning over going on that none of us are thinking about.
Exactly.
Who's at risk for anemia?
So since, if you go back to what I talked about as to what the most common causes are, since blood loss is the most common cause, I would say that young women, pre-menopausal women who are still having their menstrual cycles, they would probably form the largest groups that is at risk of anemia. That's because you have blood loss every month from their regular periods. In addition, they are also in their childbearing years, so pregnancy as well as breastfeeding uses up quite a lot of your iron reserves. So if you would just take 100 young women who are premenopausal and check them, you'd be surprised to find how many of them are borderline anemic, or even if they are not actually anemic, if you check their iron levels, you'd find that they have low iron reserves in their body, which means that they are at risk of becoming anemic too. So that, I would say, is by far the largest group, because that's normal physiology. We're talking about a large group of normal individuals here. The other group are those people who have chronic illnesses, because any kind of inflammation suppresses your bone marrow and suppresses its ability to make red blood cells and other blood cells properly. So people who have chronic ongoing illnesses and inflammation of any kind would be another large risk group. A main group in this is people with chronic kidney disease, because the kidneys make the chemical called erythropoietin. That's the chemical that stimulates your bone marrow to make red blood cells. So people with chronic kidney damage are another major risk group. people who have had major bowel surgeries or who have bowel problems, because iron is absorbed through our bowel like other nutrients, and if we run low in iron or other vitamins that the bone marrow needs to make blood properly, then those patients would form another risk group. I would say the patients who have any kind of bone marrow disorders, either benign blood disorders or cancerous blood disorders, would be other risk groups. Probably the rarest one would be the ones who have intrinsic problems with the blood itself, like certain genetic abnormalities that cause your red blood cells to break down faster than the 90 to 120 days. Those would be probably the rarest group that we would be encountering.
What kind of symptoms would a person have if they were anemic?
So, like I said, a lot of times the symptoms of anemia are very insidious, very subtle, and they are often not noticed. So, the most common way actually in which anemia is diagnosed is often through a routine blood test, not really through a symptom that somebody goes to the doctor with. Now, if your red blood cells go low and you have less oxygen delivery to your tissues, generally what you would feel is somewhat tired. That's what most people would notice, but people feel tired for a lot of other reasons too, so that's not something that you would go to the doctor for. Also, if anemia develops slowly, your body can actually get used to that low hemoglobin level, so that you can be anemic for a long time before it's ever picked up. And it's surprising, sometimes we see patients with very, very low hemoglobins, very severe degrees of anemia, who say that they don't really feel a whole lot different from normal just because it's happened very slowly and the body's gotten adjusted to it. So this is one of the diseases where symptoms actually should not be the reason why you should go to the doctor. It's often picked up because of your routine blood checks or doctor's checks that you should go for. Especially if they have pre-existing like lung disease or heart disease, they may notice that their breathing is harder, or they're starting to get chest pain more often or more frequently than they were before. And that may be sometimes, that may be how patients present with just shortness of breath or an episode of angina or chest pain brought on by the drop in hemoglobin.
Wow, so there is a risk to having anemia and not having it diagnosed.
Definitely, yes.
So when should you see your doctor?
Like I said, the majority of anemia patients are actually picked up on a routine blood draw, not because they actually have symptoms. So I would advise patients that you make sure that you keep your regular health maintenance appointments with your doctor. Most patients will get a blood draw once a year or maybe twice a year at least. That's really the best way to pick up anemia before it really starts causing problems. But again, in general though, if you're noticing the symptoms that we talked about, meaning that you're more lightheaded than usual, if you're noticing a drop in endurance without any obvious reasons, if you have heart or lung disease and you feel that you're doing worse, you're having more chest pain or you're having more shortness of breath, those could be warning signs that anemia could be developing and making your underlying condition worse. So, however, the majority of anemias will be picked up on routine exams. So again, I have to stress that seeing your doctor on a regular basis for your health maintenance is probably the best way to pick it up early before it really starts causing symptoms or problems.
All right, we're going to have lots more to talk about, but first we're going to take a break.